So the thoracic spine, as you likely know, is the most stiff portion of our spinal column. There's about 20 degrees of lateral flexion in each direction. There's about 20 degrees of extension spread out over 12 motion segments. So if you do the math on that, that's not much extension available per motion segment. Thoracic spine moves in all of those directions, including flexion and rotation, but by far in clinical practice, the most important motion that we deal with for our patients is getting them out of kyphosis and keeping them out of kyphosis. And the only way to do that is to have good exercises that move our patient's thoracic spine in the direction of extension or backward bending. So this is what we're going to demonstrate now. So we have an exercise set up where there's an exercise mat, a swimming noodle, which is a small diameter, with a dowel rod placed in it so that it's firm. Above that, we have a folded pillow to capture our lower cervical spine so we keep the cervical spine in a safe position. We're going to have the patient safely transition from a double kneel position right down to approximately the T7 level. Because from T7 up toward T1, that's where you're going to clinically find most of your stiffness impairment, limiting thoracic extension. For our lady patients, we tell them to target their bra strap and have the swimming noodle just above their bra strap. That typically correlates with approximately the T7 level. Now the therapeutic exercise motion looks like this. Support the head and neck and really relax and feel the weight of your head in your hand. Keep the cervical spine slightly flexed and do not let the cervical spine move into extension as you extend the thoracic spine over the top edge of the swimming noodle. Perform 6 to 10 repetitions and then scoot down the noodle about 1 inch, which will take you to the next motion segment. Scoot down approximately 1 inch to get to the next motion segment. This is an angular motion. We can also teach the patient to translate backward with more of a linear motion, which sometimes feels good and also stretches the thoracic segments in the direction of extension. One note, as the swimming noodle gets about even with the top of the shoulders, that's where the exercise stops. Getting the noodle any higher would take the noodle into the cervical region, which we do not want to do. Again, this is our principal self-mobilization procedure for thoracic backward bending.